Hello and welcome to HITRUST and HIPAA and its implications on Indian technology service providers. My name is Ashita Alva and I will be the moderator for today's webinar. Today, our speaker will help us understand why health data is critical, highlight differences between HIPAA and HITRUST, talk about how to become HITRUST ready, and managing overall risks with a HITRUST certification. He will also talk us through a case study of an organization meeting HITRUST requirement in record time. Well, I can see most of you are from health tech or security background, so I hope you find the webinar informative. Also, we would love to hear from you and answer any questions that you may have regarding HITRUST. So share your comments or ask questions on the Q&A tab at any time during the webinar and we will address them. So now I want to introduce our featured speaker, Aditya Uttapa, who is the Chief Cybersecurity Officer at Isha IT. Aditya, along with being a certified HITRUST assessor, has over a decade worth of experience in security alone. He has helped numerous organizations in their HITRUST journey. Well, also as a matter of fact, Aditya and I have worked together in the security domain for over 7 years now. All right, now without much ado, over to you, Aditya.
Rashita. Good evening and namaste, everybody. Thank you for taking out your time this evening to join our webinar on HITRUST and HIPAA and how it affects Indian organizations. That said, today's a Thursday. It's a nice evening. I hope you're sitting down with a nice cup of coffee. The weekend's almost here. I'm going to make sure that this particular webinar is as informative and fun as possible. So a little bit about myself. That's who I am. My name is Aditya Uttapa. I'm the Chief Cybersecurity Officer at Isha IT. I have a decade plus of experience in cybersecurity, and I've implemented various standards, done penetration testing for many years, worked with global clients, the Fortune 500s, and organizations around the world. I belong to an organization called Isha IT. And who is Isha IT? Isha IT is a full cybersecurity service provider with services ranging from everything under security, compliance, testing, and monitoring, with our offices being in America, the UAE, and India. We specialize in partnering with small to medium firms around cybersecurity and technology and across various industries such as health, BFSI, manufacturing, etc., and geographies like America, India, UAE, and Australia. Now, the reason why most of the co-founders and I got together and wanted to concentrate on small to medium-sized firms is that after spending significant amount of time in enterprise security, we realized that there was a real gap in security and implementation of it for small to medium firms. So we wanted to come up with a tested methodology that could be rolled out for organizations of all sizes so that they can meet their security needs on a shoestring budget. Along with that, Isha IT is also a HITRUST CSF assessor. We currently have been an assessor for a couple of years, and we have a proven methodology for how we help our clients implement HITRUST and help certify them. Along with that, I'd like to quickly talk to you about some of the other services that we provide. Like I mentioned, we provide everything end-to-end in security, everything from security strategy to security compliance, wherein we help organizations through ISO 27001, SOC 2, HITRUST, HIPAA, and NIST CSF, etc. Do a lot of security consulting, VCSO, policy procedure dev, etc. We have a very strong penetration testing team. Ashita heads this particular team. And we also have a security operations center where we do 24/7 security monitoring. So I'm going to jump straight into it. I'd like to first break down what is health data and what are its elements. And the reason why I want to talk about this little element is most organizations or individuals feel that their health information is restricted to the insurance details and the name and their PHI records. That's not true in a lot of cases. Photographs, images, your social security number, your treatment dates, unique identifiers such as your fingerprints, your code, numbers, past records, prescriptions, all of them go in to comprise a health data record. Now, health data records today are called by various terms. You have EMR, which is electronic medical record. You have EHR, which is electronic health record. PHI, which is the most popular, which is protected health information, a classification most popular in America, along with EMR. Then you have other ones such as Singapore's national EHR. Malaysia calls it EHR as well. India has a PHR in the works now. So these are some of the various terms, but net, it's almost the same. They all comprise with the various elements that I've called out here. Now, when I talk about health data, most organizations, and individuals feel that health data records only lie in a hospital or your doctor, but that may not be actually true. So I've tried to pictorially represent where all does your health data go and what are the entities that come in contact with this. So a patient record could go to the government, it could go to a care manager, a hospital, a retail pharmacy, your house, laboratories, your employer, imaging centers, your payers, your insurance brands, care centers, etc. So if you see, the health record is something that travels across these various entities, and all of these entities have access to your health record or stored your health record, right? And hence would be liable for protecting your health record, right? Along with all of these entities, you also have an entire army of organizations that help make these companies successful in the form of vendors, service providers, partners, infrastructure providers, and payer solutions. That said, the reason why we're talking about health data today is that I'd like to call out, why is it the new oil? On an average today, the sale price per record is $429, comparing it to an average of $5 for a PAN or a credit card record, right? So data breaches in the health sector are more than 60% more expensive than other sectors, and it averages out to about 6.5 million today, right? And healthcare, I think the biggest motives have been financial, right? And the data that has been compromised in most cases has been medical records. And why has that happened is because of human error, privilege misuse, and hacking. Now, healthcare is the only industry where internal threat circumpasses external threat, right? That is why privilege misuse and human error is so big, and hacking is just one small piece of the pie, right? Um, in the last 9 to 10 years, there've been more than about 2,500 breaches. More than 6 million medical records have been breached, and about 77% of all data breaches in 2019 were caused, at healthcare providers, right? So that's a little statistics for you. Now, coming to why does this play into India, and how does this apply to Indian technology service providers? Firstly, the worldwide health data in India, it applies, why does worldwide health data apply to India is for the simple fact that India is today the technology providers to the world, right? They support entities across various geographies and industries, and they are the biggest consumers of any type of data today. The second point is that directly and indirectly, these entities and Indian technology service providers are coming in contact with health data. Either they're transmitting it, either they're processing it, or they might be storing it. They might be a billing entity for a hospital. In these cases, the information comes to India and the billing process takes place. The third importance why health data in India is because of the advent of country-wide electronic health record schemes. Every country is coming out with their own electronic health records, and it's just going to increase. In the next 5 years, it's pitted that more than 70% of folks who have access to a computer will have a medical health record as well, right? Next is there's been a significant boom in health tech, and India has been on the forefront of this for, after America, wherein, they're providing various analytics, diagnostic services, etc., of how, you can better predict uh, certain conditions. And lastly, the reason why we're talking about, and the main reason why we're speaking about health data security today, is all of these Indian service providers have a requirement to showcase health security maturity to existing clients and partners, for the simple reason that they are taking in this critical information into their systems and processing or storing it, or transmitting it, right? So it's a mandate today for these organizations to showcase health security maturity. Lastly, in a lot of the new, I think in 2020, 2019, we have seen, as a company, we've seen a lot of organizations coming to us stating that they need help with health data security and meeting a particular compliance, for the simple reason that it's a mandate today to win new business. Now, some of the organizations that might come under the purview of health data security, your health techs, whether you're a SaaS provider, whether you're in analytics and taking in health data record for analytics or predictive analysis, whether you're a software provider for these healthcare institutions, if you're an MSP that's supporting health or Medicare organ institutions, if you're a revenue cycle management provider, a payer solution, hosting provider, cloud service provider, if you're taking folks from physical networks to the cloud as in a lift and shift company, if you're an EAP, you're a CRM support center. So you can see the list is endless, right? And all of these organizations will because of the nature of their business and because of the fact that they come in contact with health data, they would need to showcase health data security maturity. Now, moving forward is, how does one really do that? So whenever you look at security, it's all about frameworks, right? And there's a very famous phrase that comes to mind is, a goal without a plan is just a wish, right? And these frameworks are the roadmap, or these are the guiding systems that help an organizations go from no security to a good security posture. Now, over the years, the likes of ISO 27000s have been very popular in India, and we've also seen NIST and other ones, COVID, gaining popularity. But I'd like to talk about one specific framework today, which is HITRUST CSF, right? HITRUST CSF is a health data security centric cybersecurity framework. This is the only one amongst this entire list. And what it is, or how does it aid an organization in building their security program, is that it enables you to identify your risks. It provides you strategies in how you can manage these risks. It enables you to identify your vulnerabilities, and also, lastly, understand your overall security posture. What it also gives you is the fact that it gives you a certificate, which is a validation to your partners and clients, that states that you have met certain security requirements, hence you have a good security maturity. And this, of course, goes a long way when you're filling out those super long vendor risk questionnaires. Now, coming to a former or a very popular health security standard, everybody's heard of it, HIPAA. So HIPAA's been around for many years now, and it was actually passed in 1996. HIPAA's primary goal was to make it easier for people to keep health insurance, protect their confidentiality and security of their healthcare information, and help healthcare industry control administrative costs. So those are the three principles of HIPAA. Now, HIPAA comprises of 5 components: analysis, policy procedures, data security, data center responsibilities, customer responsibilities, and technology. Now, HIPAA is something that organizations have been stating as meeting the requirement for HIPAA, but there's been no third party certification available that validates whether an organization actually meets HIPAA's requirements or not, right? um, I'd like to call out the fact that most organizations state that they are HIPAA compliant, but the reality is they're usually far from the truth, and hence the emergence of HITRUST. What happened was, A lot of organizations stated they were meeting HIPAA requirements, but over time, end organizations or larger insurance brands or larger payer solution brands realized that some of these organizations are actually not meeting HIPAA requirements. So every time they access uh, health data of associated to a bigger organization that's storing or processing, right? It's putting this health data at risk. That only means that the end bigger organization is liable for this. So that's when a lot of these larger insurance brands, a lot of these larger brands came together and decided that there has to be a third party certification, a third party validation that has to happen. And how did they come up with this particular thing? Is they coined it HITRUST. It's a full form. It's a short form or something. But it basically, what it was they took the concepts of many standards and built it on the base of ISO 27001 to create a particular framework which enabled organizations to be more prescriptive rather than subjective, as in the case of HIPAA. Now, now I understand that a lot of your organizations, a lot of you might be required to showcase HIPAA compliance, and I want to clarify this, that HIPAA and HITRUST cannot be interchanged, right? A lot of organizations would still have to meet HIPAA requirements and showcase that. HITRUST is just another stage to this entire journey. So I'd like to quickly talk to you about how can you meet HIPAA requirements. I think if I break it down into 5 steps, it is determining your security requirements, understanding what kind of data do you possess and how is it sent out, and set protocols for secure transmission. Next is create a threat profile to understand how can your data be leaked or lost. Fourth is to implement secure communication practices. And lastly, educate staff on security policies. Now, that said, if I break it down into 10 steps that I would suggest to an organization, first is to draft a security policy and name a security and privacy officer. Next is to understand and identify types of health data and its locations. After that, I would suggest a HIPAA risk analysis or an assessment to understand what kind of inherent risk or what kind of risks come into picture because of the nature of your business and how you take in data. Fourth is to conduct a technical analysis in the form of a pen test or a vulnerability scan. Fifth is to draft and showcase policies and procedures and controls that protect EPHI and are in line with the security and privacy rules, of course, right? Especially email and mobile. I think those are two very important policies because a lot of the leaks happen due to these two channels of communication. Next is to conduct a security awareness training for your staff, develop a secure privacy notice on your website, solidify business associate relationships. So understand what kind of vendors work with you, what kind of service providers work with you, who are you a service provider for, understand what kind of data do you take in from there, what kind of data goes out from you, and bind them using contracts for security, right? Next is establish a protocol for breaches. It's very important. It's one of the most important rules in HIPAA is to have a breach notification SOP. And lastly, and most importantly, ensure your policy procedures are followed to the T. Right? Moving forward, I'd like to quickly talk to you about what is the difference between HIPAA and HITRUST. So like I said, HIPAA is framework based. It's quite open-ended. As a security auditor and implementer, I would say it's not very prescriptive. There is no third-party certification. The updates are rather irregular, and it's based on the Congress of America. And lastly, there is no third-party independent contractor who can certify you against it. So there's no way for an organization to state whether they really meet HIPAA requirements or not. Hence, leaving this big gray area. If you're an organization working with hundreds of service providers, you don't know whether your service provider is actually secure or not. That gave birth of HITRUST, which is more prescriptive. It's more robust in its security requirements. It's updated annually. It's recognized as standard, but for healthcare organizations and the security, and it has third-party independent contractors. HITRUST in the last couple of years has fast grown into a standard that is mandated for doing business with other healthcare organizations. So if there's ever talk about health data, any or you're becoming a service provider for a company that is involved in the health spectrum or taking in any sort of health data, they would always talk about HITRUST today. Now that said, what are the benefits to HITRUST, right? First, like I said, it's giving you a roadmap. It's giving you a methodology, a method to the madness called security, thus reducing your chances of a security breach and incident because of the sheer adherence to HITRUST, because you would improve your controls, because you would improve your monitoring, because you would improve your policy procedures, you would tighten up your security operations. By virtue of that, you would automatically reduce your chances of a security breach or incident. Next, it's a structured program. It kind of provides an instruction manual for successfully navigating security. An instruction manual, and why I say that is because security is ever so evolving. There are new standards coming up every day, and it becomes very hard for organizations to stay abreast with these standards while ensuring that they maintain everyday security. Next is providing health data security across the organization. By virtue of this, you automatically have CIA in place for electronic PHI, which is confidentiality, integrity, and availability. Your brand reputation goes up because of a HITRUST certification, because this increases trust with clients and partners. It's also a norm today that most organizations have to meet. By getting HITRUST certified, you would be meeting this compliance norms and also meeting various vendor risk requirements of larger organization. And lastly, it provides a competitive edge over other service providers who are trying to work with US-based health entities or health service providers. So I'd like to give you a quick 101 on what HITRUST is. What is it all about? HITRUST is today slowly becoming a gold standard to showcase health security. It has 19 domains that encompass everything security, starting from information security to security monitoring, your access control, education of employees, and mobile security, etc. And when it comes to these 19 domains, the number of requirements kind of vary from 200 to 800. And that's because it completely depends on the factors that you have chosen while scoping your entire organization, right? And I'm going to talk about it in a bit, but your requirements can kind of vary between about 200 to 800 for the simple reason that, it depends on what type of organization you are, how big are you, how much of health data do you take in, how do you store it, et cetera, et cetera. And there are also 3 levels of implementation. The current version of HITRUST is version 9.4. It's delivered and audited on a portal, which is developed by them called MyCSF. This needs to be audited by a certified HITRUST assessor. Today, HITRUST is slowly being adopted beyond healthcare. It's also being taken as a standard in in travel, in SaaS, various other areas of business. It has an assess once and report many principle, for the simple reason that if you go through your HITRUST once, you can provide this as a certification or its report to various larger entities wherein you're a vendor for. So you don't have to fill out those super long, elaborate vendor risk questionnaires anymore. You can just hand over your HITRUST certification and credentials. HITRUST today is growing rapidly in APAC. So those are some of the things that I wanted to quickly talk about before we dive deeper into HITRUST and its nuances. The salient features is the fact that it has an attestation. You're able to showcase maturity to clients and partners. For example, I know for a fact that all vendors of Aetna, Express Scripts, Humana, and the likes of all these other large health brands require their service providers to be HITRUST certified. Lastly, the way that HITRUST is built, like I mentioned, you can have 3 levels of implementation. It completely depends on, how much of data do you take in, how do you take it in, et cetera, et cetera. So it's flexible to all organizations. All organizations don't have to go through all 800 requirements. If you're an organization that's not taking in as much of health data, or the way that you take in your health data is not direct, right? This would of course bring down your requirements drastically. Right? Now, some key concepts. Now, I'd like to talk about the most essential piece of the puzzle is scoping, right? Now, the simple reason why is the fact that, because this webinar is in India, I'd like to call out this little facet that it's always easier to guard or to protect a cricket pitch rather than the entire stadium. The scope is the key. We've had organizations wherein, they've come to us and they said, we want to be HITRUST certified. They didn't know how to get started. Excuse me. When we got started, we realized that we were able to reduce the scope significantly for that particular organization because they only worked with maybe 4 or 5 health entities. So we were able to reduce their scope to only one cloud instance with less than EC2 instances, right? So there are cases in which we are able to drastically reduce the scope. There are also cases in which we've worked with organizations who, like one particular organization who wanted the entire entity across 8 countries and 2,000 employees, all the functions to be certified for the simple reason that they lived and breathed health data, right? So scoping is more important. It's very important to understand that HITRUST doesn't need to be at the organization level. Unlike the other standards, you can pick up one section of your organization and have it certified for HITRUST. Next, the number of requirement statements is calculated on MyCSF. That's the tool on which the auditing and the self-assessment happens. And based on the responses that organizations provide to the various scoping questions, it is determined, how many requirement statements that might come into picture. Right? So it could anywhere be between about 200 and 800. There are 2 types of assessments that HITRUST supports today. There's the readiness assessment, which doesn't need an assessor firm. And there's the validated assessment, which is nothing but a certification assessment, which needs to be done by an assessor firm. And assessors have about 90 days to complete the entire audit and provide the recommendations to HITRUST. From a certification standpoint, like I mentioned, there were 19 domains. And I'd like to call out one little element is the fact that you need to pass each domain with a score of 72 or more, or with 62 with corrective action plans. Understand that all domains are assessed, right? So there's no, unlike other frameworks, you can't remove a domain, it can be excluded, cannot be marked not applicable, right? All domains are looked at end to end unless that particular domain is just really not applicable. And the not applicable factors are usually assessed with a magnifying glass by HITRUST, is to ensure that there's no risk that is forgotten or overlooked and everything is taken into consideration. Now, how do you come up to the passing score of 72? For every requirement statement, there is a scoring mechanism in place, right? Now, the scoring mechanism is based on 5 factors: policy, procedure, implementation, measured, and managed. Policy is 15%, procedure is 20%, implementation is 40%, measured and managed is 10 and 15. Now, policy is your high-level statements, just talk about your information security and IT goals. Procedure is the standard operating procedures, the workflow, which call out what tool is in place or what control is in place, who's responsible, what is the review cycle, etc., right? The implementation is all to do with whether that implementation actually exists. So an example would be of a policy would be security awareness is a mandate across the entire organization. The procedure would be that you're using solution X for doing a biannual security awareness training for all employees. Along with that, all new employees need to go through this training before they get access to a laptop. And there's also an annual phishing test that is conducted. So the implementation would the evidence would be, giving out information or sharing reports of phishing tests, sharing reports of the security awareness training, etc. And then comes the measured and managed. Measured is all about measurement, effective measurement or of that particular control. And lastly, management is what kind of activities do you take in for improving, right? So improving that particular control requirements score, and what kind of mechanisms do you have to sustain and improve over time, right? Now, each of these 5 areas have a rating of their own. And I'd like to call it, there's a small error there. It's not domain weighted scoring. It's actually, it's associated with the requirement statements. So each of these sub areas have a rating between non-compliant, which is 0%, to a fully compliant, which is 100%. And this is based on the HITRUST CSF control maturity rubric, right? Now, lastly, unlike other standards or other frameworks wherein you can have a particular control in place, and once everything is in place, you can literally go in for certification the next day. That's not true. In the case of HITRUST, you need to have the controls in place for at least 90 days, and there has to be evidence that needs to be furnished based on the sampling requirements. So that's a little bit about HITRUST. How can an organization get HITRUST certified? They can get an active subscription to MyCSF and start looking out, start scoping themselves out, start understanding what kind of requirement statements come into purview, and filling them out by understanding current control state. Next is by signing a certified assessor who will take you through the entire journey of certification to help certify you. Now, in a lot of cases, organizations work with a HITRUST implementation partner who essentially aids them in multiple ways. The first is scoping. The organization helps reduce and contain the scope as much as possible. I'd like to call out, I've just put some numbers here, but if you're an organization with less than about 10 million records, your assessment size would be about 300. If you're between 110 and 60 million, it's about 375. And above 60 million records, your assessment size would be about 450 requirements. Now, that said, this also and the number of requirements can also go up if you add additional regulatory factors such as 21 CFR Part 11. You have the CMS requirements, etc. So all of these could significantly take up numbers. Next is organizations work with an implementation partner to help them create artifacts in the form of policies and procedures that are in line with HITRUST, with selection of controls that meet the requirements of HITRUST. Next, conducting supplementary services like penetration testing, risk assessment, and security monitoring. And lastly, aiding with the setup and for gathering evidence for implementation, managed, and measured. Right? Now, I'd like to quickly just showcase how is it that we help organizations meet HITRUST requirements. We basically have four phases. We essentially start the organization with phase number 1, which is what we call as a readiness assessment. We take an organization through understanding of who they are, understanding the scope, identifying the necessary assets and their criticality, defining a target date for certification, and then working on implementation standards and strategies and which teams get involved. After which, we go in and we do a high-level gap assessment, a high-level domain-wise gap assessment to understand whether they're really ready for HITRUST or not. So we do a current state analysis, after which we are able to identify the gaps, and then we define those controls that would meet the requirement. We would map existing controls, and then define future controls. Next, we would move to a phase wherein we would be drafting and updating current policy procedures, selecting controls again based on some changes have happened due to some strategic changes in the organization. So selection of controls, what kind of services or products might be helpful for an organization to implement or meet HITRUST requirements. So what kind of SIM solution or what kind of MDM solution can you have? So we help organizations figure that out as well. And then the effectiveness measurement of how effective the control is, start gathering some information based on internal audits, set a frequency for checks, etc. And then we move to the pre-audit phase, wherein we do a final review to ensure that the organization is meeting high trust requirements. And then a separate team in our company would go in for and conduct a validated independent assessment to find out whether the organization meets high trust requirements or not. And this is when the organization goes in and updates my CSF to have all their responses along with scores and evidence. And that is then reviewed by our team to understand whether they really meet high trust requirements or not. HITRUST is a certification that is valid for 2 years. So at the end of year one, you would have to go for an interim assessment. And in an interim assessment, you're essentially the organization needs to showcase evidence that they have sustained high trust and they have improved over time. Now, some common pitfalls while implementing high trust. Over the years, I've seen organizations make these, I think, 5 mistakes. The first is picking the incorrect scope, maybe too less or too much, maybe taking a scope that is the entire organization, and frankly speaking, gathering evidence for the entire organization can be a Herculean task. So it's very, very important to try and get the scope to the most essential and keeping it that way and cordoning it off from all other business processes and getting that certified. Next is, believe it or not, lack of stakeholder buy-in. There have been cases in which strategically the organization, the CXO or the management, has different goals, or there have been cases in which security teams have failed to understand what is the requirement for high trust, in the sense that they've not been able to understand what is the target date that has been given by the management. Next is not understanding where the held data is actually located, so which kind of boils down to the scope. Next is a real gap between the process and implementation, having inadequate evidence for implementation, and lastly, not factoring inheritance of security controls. Now, this is a big one, I think, the not factoring of security controls. It's important to realize that most organizations today are on various shared platforms. So you might be on the cloud, you might be on Azure or AWS, you might be on Office 365. It's important to realize that all of these are also high trust certified. In a lot of cases, you can inherit security controls from them. And broadly, this can reduce your load for high trust by about 20%, wherein you can inherit some of these security controls and benefit from that. Next is when you go in for the pre-audit, there are control failures. There's some organizations don't even conduct a pre-audit. They do an implementation and go straight in for certification. And that's when they realize that a lot of the cases, the controls have failed or they're not actually implemented the way they're supposed to. And lastly, not leveraging experts for rollout and implementation. It's always important to understand that only a cardiologist can help with a heart disease. So working with the right kind of experts is important for an organization to have success in high trust, for the simple reason that high trust is a very, very evolved and evolved security standard. Now, from a high trust timeline standpoint, I'd like to quickly talk about a timeline that we've typically seen organizations follow. So the preparation, I've noticed typically takes about 1 to 6 months, and it's when organizations go into the discovery phase, wherein they're trying to figure out the scope, trying to figure out where their health data lies. Next is doing a high level readiness assessment, creating of policies and procedures, implementation of controls, gathering necessary evidence, setting up a measurement mechanism, and lastly, doing employee training and education. So that typically takes about 1 to 6 months based on the type of organization you are. Next is a pre-audit, and this is something that I recommend to all organizations. It's very, very important for an organization to understand whether they're actually audit ready. There would be some final gaps that might come up, so doing a final remediation and getting an approval from the team that's conducting the pre-audit for the go-ahead for audit. Now, at this stage, this is where this is handed over to the assessor team or the assessor entity, who comes in and does an independent validated assessment. And this typically takes about 2 to 3 months. HITRUST requires, gives up to 90 days, but it typically takes about 2.5 months to complete a validated assessment. The entire assessment is conducted in a tool called MyCSF. The assessor comes in and reviews the process, the implementation, the measurement metrics management. Also, evidence is seen. So all evidence has to be collected and uploaded, and this is reviewed by the auditor. And at least 90 days of steady state evidence should be present on HITRUST portal, right? After which all of the assessors' recommendation, the final scores are then sent to HITRUST. Now, HITRUST is I think the only security guild out there that does a QA on its own. So then HITRUST conducts an independent QA, and then finally a certificate is generated, right? Uh, After about 11 months is when typically an organization should start thinking about their interim assessment. This typically takes 2 weeks. And in the interim assessment, organizations need to show two things. They need to show an improvement in their current security posture. So an assessor is going to come in and see whether those corrective action plans have been implemented. Has there been any improvement in, or have you met some of those requirements? Next is checking for sustenance, validating whether HITRUST requirements are still being met or not. So at random, the assessor looks at a few requirement statements per domain and assesses whether HITRUST is still being sustained, right? I'd like to call out one little element here, that there's no version change in HITRUST. So HITRUST typically makes a couple of version changes every now and then, but if you've been certified on, say, version 9.4, your interim is also conducted on 9.4. But that may not be the case when you're going in for renewal. So after 8 months is typically when you're inching towards the 2-year mark of being certified. You're about 19 months in, and like I mentioned, HITRUST needs to be renewed every 2 years. At this particular point, there might be a scenario wherein a new version of HITRUST might be applicable, for the simple reason that security is evolving. There are new type of threats. Maybe you've changed your scope. The requirements would, of course, change on the basis of that. Additionally, because there are new threat vectors or new nuances to security, the HITRUST in general would add more requirements. So that change might happen. So in that particular case, it's always good to factor in about a month or two of prep time before you think about validated and ensuring you actually meet those requirements and do a pre-audit and go in for validated. So that's to do with the HITRUST timeline. I hope this kind of gave you an indicative number. And this is typically what we see for a mid-sized organization with a decent security posture would take. Now, at this point, I'd like to quickly jump into a case study. I'd like to talk about an organization that we helped certify on HITRUST. So a health tech SaaS company based in the Northeast of America reached out to us and said, they need to showcase security maturity to their clients on a very, very short deadline, a very, very tight deadline. And the only way to do that was to get certified against HITRUST. So when we went into the organization, we realized that there were many challenges associated to securing this organization. The first was the organization was unaware of locations for health data. Second is they rapidly scaled IT and infrastructure. They were across multiple cloud service providers. They were, between, they had a couple of locations. They were leveraging more than 30 different types of technologies, right? Next is we realized that there was very little security maturity because this was a startup and they organically grew. There was little to no security maturity, and there was absence of any type of framework in the form of policies and procedures. Next, we realized that there's no security expertise in-house. And lastly, they needed to showcase security maturity in a very, very short deadline to their clients, right? So how did we go in and how did we try and dose this particular fire? The first thing what we did was we helped the organization, we sat down the organization, helped them understand where does the health data lie and what is it that they need to secure, right? After which we helped advise how can they coordinate off certain sections to reduce their scope for HITRUST, right? So that was a discovery. Next, once we discovered this, We spoke to some of their end clients, helped them understand, that we are helping this particular organization through their entire journey of HITRUST. After which we went in and did a readiness assessment. This was nothing but a high-level gap assessment to understand where their gaps lied across various domains. Simply looking at security monitoring. Did they have a SIM? Security awareness, did they have a security awareness solution? MDM, did they have one? So we put together about 40 questions and ran them through this through a in an interview style meeting, in which we took asked them these questions, and then we called out what are the major controls that were missing, and what were the things that they had to implement, and what kind of solutions would map to these requirements. We started rolling out HITRUST. Once we understood current state, we understood their current operations, we started rolling out some of these policies and procedures along with a RASI of who's responsible, accountable, etc. We'd identified the types and locations of health data at this point. Oops, sorry. Um, After which we drafted up, then we went on to identify. So we did a full gap assessment, a risk assessment, a pen test. And how we did it was we did it in-house. We helped them identify the risks and vulnerabilities. And then we drafted up a plan for improving continuously. In between, of course, there was an entire phase in which we were helping them implement some of those controls, helping them write some of those policies, procedures, as mentioned earlier. And we did a pre-audit, and they were ready for certification. And I think in less than 6 months is when these folks were able to meet HITRUST requirements and go from no security to meeting HITRUST security requirements, which is rather stringent, right? And we were able to help them get there in record time with the optimum use of their time, budget, and resources. And in the end, they were able to get the HITRUST certification, which was their ability to showcase to clients, their security posture. All right, and lastly, how do you work with the right partner? How do you know who's the right partner for you for your HITRUST journey or HIPAA journey? How do you find your implementation and partner and assessor? The first is to assess their experience and reputation when it comes to HITRUST. Speak to them, who are their assessors, where are they based, etc. How many assessments have they conducted? Next is look at their projected plan of action for taking you to HITRUST and what kind of timelines they're promising. Third, what kind of outcomes and key results can you organize? Do these folks have a very hands-on or hands-off attitude towards implementation? It's always good to work with an entity who really wants to get down and dirty and wants to take you through the entire process of HITRUST. Next is figure out whether he's the right fit. Maybe it's a very large organization, security organization, that may not be a right fit for a mid-sized or small-sized company. I may not understand the budgetary constraints or the time constraints of a smaller organizations. So find out whether they're really a good fit for you through case studies and testimonials. Lastly, have a discussion on the cost proposal, look at the terms and conditions, see what they promise, see what is the length and breadth of their assistance, and validate all of this. And in the end, successfully move towards HITRUST. All right, so that was about HITRUST and I tried to give you a little insight into HITRUST, HIPAA, and why is it important for Indian service providers. Frankly speaking, the reason why we had today's webinar is we've been seeing a significant spike in organizations in India having to meet HITRUST requirements, and we're working with so many of these entities. I thought it'd be a great opportunity for us to provide some awareness and knowledge sharing for our other organizations in India. So I hope this was helpful. So I have some of my contact details. I'd love to connect with you folks and send me a note on LinkedIn, follow our page on LinkedIn for updates on HITRUST and HIPAA. So the floor is open for questions. I hope you ask a lot of questions. Ashita, over to you.
Thank you, Aditya. Yes, we do have a couple of interesting questions. First one, how long does HITRUST implementation and certification take?
Implementation typically, like I'd shown in the timeline, it can take anywhere between about a month to about 6 months. Completely depends on your security maturity. On an average, an organization can be HITRUST ready in about 3 to 4 months. And the certification takes about 2 to 2.5 months. HITRUST, of course, gives you a 90-day window, but most assessors take about 2 months to complete everything and square it away and send it to HITRUST with their recommendations. HITRUST typically takes about 8 weeks for their QA and for issuing of the certificate.
All right, we have a question regarding availability of questionnaire or checklist, and if a self-assessment can be carried out for to become HITRUST certified.
Great question. So the readiness assessment that I'd called out, so there are basically two type of assessments one can conduct in HITRUST. One is a readiness assessment. The other one's a validated assessment. A readiness assessment is nothing but a self-assessment, and you can go and do that on MyCSF. Unfortunately, HITRUST doesn't publish their questionnaire online, but you can subscribe to MyCSF and get access to all of this. It's a GRC platform on which you can, go and feed necessary information about your current security posture.
Okay, just one more question. As a technology provider, can we get the certification for software, or the organization needs to get certified, or does the client need to get certified?
Okay.
I, yeah, I think
I,
it's
I I
yeah.
didn't get the last bit about the client, but I'm going to try and answer the first part. So very, very great, very good question. I think this is something that a lot of the SaaS players that we've worked with have kind of gone through. So HITRUST cannot certify a software. What it can certify is it can certify a environment, right? So your SaaS platform and the environment on, say, in the cloud with all of its supporting infrastructure, and the teams are the ones which would be the scope for HITRUST. That said, this wouldn't have to be your entire organization. It can just be one BU or a sub BU associated to that particular SaaS application or technology service that you're providing.
Uh, okay, and I think the second part of the question was if the end customer needs to get certified, who is using the software, or the organization gets certified, would that suffice? But you answered that question as well.
Okay.
So the next question is, what is the average cost for the organization for which certification cycle, for each certification cycle?
Yeah, that's a tough one to say. I mean, I know how much we charge, but but HITRUST typically can be a couple of tens of thousands of dollars, and for large organizations could go up to about $100,000, right? So I hope that answers your question. By no means would I say that it's a very easy certification, but the price range would typically be based on how big your scope is. I
All
see
right.
another question about what
Ye
tools do you use
yes.
in general for pen testing? Well, for pen testing, we use multitude of tools. We of course have a lot of commercial scanners that we leverage. For networks, we use Nessus. For applications, we have Burp, NetSparker. We use Micro Focus. A couple of their utilities. We also use various pen testing platforms, operating systems like Kali Linux, and it completely depends on what type of application or network host it is. I've used close to about 200 different tools for doing pen testing, but more than happy to answer over a one-on-one. See another question coming in. Do we have any penalties in India against breach of EHR and PHR? Good question. Uh, it's not there right now, but if you're an organization that works with US based companies and you're taking in or you're coming in contact with health data, then you would be held liable and you would come under the purview of that particular fine, for the simple reason that if suppose data breach happens because of your end organization, the main organization that you work with gets fined, and then they obviously push the fine over to the service providers. So that's typically what's happened. And I've also seen in the last 2-3 years, a lot of the service providers for these bigger organizations are being targeted by hackers because of the simple reason that hackers know that maybe they might be lower in maturity from a security standpoint or may not have the security robustness as compared to a very large organization. Right?
Yes, I think that's about the questions. that we
Yeah, I see a
have.
question from Shri Hari. I think Ashita's answered that as well. So if a new version, you don't have to go through the full process. For the interim, you maintain the same thing. If you started your validated assessment on that particular version, then you don't have to change it. That said, currently on HITRUST, you can pick between 4 versions of HITRUST to certify against. But if you've already created an instance in and you're already in that path of validated, you don't have to go in for a new version. All right, great. I think we're about
Yeah,
3 minutes to the hour. Uh, I think there were some great questions, and I really hope this was informational. I'd love to hear feedback, and I'd love to connect with all you folks over LinkedIn. Please feel free to send me a note if you have any other queries. Till then, thank you so much for your time. Stay safe, and see you on the next webinar.
Aditya, we have one more question.
Wait, I don't see it. Can one of you read it out?
If cloud
if
Okay,
service
cloud,
provider, yeah,
so
go on,
yeah,
Ashik.
sorry. If the cloud service provider is certified or compliant with HIPAA and HITRUST, does the tech provider is the tech provider data safe and state that it's HIPAA compliant? That's not exactly true because there could be multiple facets that come into picture. Yes, you would inherit a lot of the controls associated to when it comes to data security associated to those kind of associated with the cloud service provider. But it's very important to understand that cloud service providers as a platform can be certified, but it's up to the end organization to go and strengthen it. So for example, de facto encryption is also not enabled, right, on for data, right? So it's important for the end organization to go and make these changes, or to educate their employees about how they can manage health data, right? So in a lot of cases, I mean, there's some controls that you would inherit, and that's the advantage of working with a service provider who gives you that kind of who's certified. But then in a lot of cases, you have to walk down that path on your own because there are multiple elements that come into picture other than just where you're hosted. I think that's a wrap then. So I'm going to give all of you a minute back. Just kidding. So thank you so much for your time. Like I said, this has been great. I hope this session was helpful. I'd love to hear feedback. Till then, stay safe, and I'll see you guys on the next webinar. Take care and see you. Bye.